Glad we could make it. Perfect. Ready for Frank About Health? We're ready to talk honestly. This is Frank About Health. Let's get real.
Hey everybody, and welcome to a new episode of Frank About Health. This episode is called, Is It Eastern or Western Care? With my dear friend Catherine Pearson. She's the wife of Jeff Pearson, host of Invisible Condition, right here on E16 TV. She and Jeff were on Frank About Health previously, talking about the caregiver experience of his life living with hydrocephalus. Now, invisible conditions like mine with epilepsy as well as hydrocephalus are always a surprise and a myriad of confusion for people in the healthcare profession. Why? The condition is invisible. All they can do is understand whatever the patient is saying, and even then, it becomes related to a condition like, and therefore treatments are provided in absentia of the real cure or real solution. So there always becomes a debate during the ongoing life support of people living with recurring invisible conditions. So this brings to mind, especially in my mind, the whole nature of the healthcare system globally. Now, we have all seen different guests on Frank About Health talk about their views related to whether it's policies in Washington or whether it's insurance versus whatever anyone out of pocket can care for. But when you're dealing with an invisible condition, that may have a play in it. But what is not frankly discussed is what is the difference between Eastern and Western medicine and how they would treat the same condition. So I'm going to do a unique situation here on this show. Both myself and Catherine are going to share our experiences with the healthcare system and how they have treated Jeff's hydrocephalus and my epilepsy. And then we're going to have the equivalent of a point counterpoint of which one would probably be more beneficial. With all the insurance restrictions and hospital restrictions and medicine restrictions, there's still alternative treatments that people can try. But somehow, because of cost or because of resistance or fear or not sure if any side effects would occur, people stick with the Western medicine system, which lacks a lot, in my opinion. So therefore, before we have this conversation, myself with Catherine, I will issue a medical disclaimer. There are going to be thoughts and opinions and views that some of you may not agree with, and that is okay. However, if you do find that it is useful food for thought, I would hope that you take a listen, share it with people who probably have more of an understanding of what we're going to talk about, and try to get some consensus. We're providing our views and opinions for you to think about and determine yay or nay. We're not pushing any kind of treatment protocol. We're not even pushing you to listen to the entire show. We're just pushing you to think for a bit, because at the end of the day, the only one truly responsible for your healthcare is yourself. All right. And therefore, to do that, you need to be as informed about as much as possible about what exists, what are the options, what are the alternatives, what have you not thought of that you could try, as well as take ownership with your doctor, your nurse, your specialist, your EMT, whoever, so that you work together in having the best quality of life possible. Okay, Catherine, that's my mantra. That's my disclaimer. So now let's just have our natural conversation about our frustrations, opinions, and views about our conditions and, of course, the healthcare situations that we have been choosing to work with, and see what can work, maybe a combination of the two.
Yeah, I love it. And thank you so much for having me on to be able to share my thoughts and some of my passionate ideas.
Yes. Oh, it's my pleasure. That's exactly what I've been making sure that every guest that comes on this show just, ignites that passion and that thought process, because there's so much chaos out there when it comes to our healthcare today. I mean, recently, as I get into my story, with helping my father in his recent emergency room stay, I found myself using all my hats, including that of a lawyer, even though I'm not one. I mean, a medical attorney, or trying to think how the law would view how Medicare and Medicaid work in the situation. So at this point, I think that this is going to be a totally organic conversation between the two of us. I figure the best thing is to start with you and Jeff's hydrocephalus and the journey that you had worked in with the hospital systems, as well as even any alternative treatments that you had to take on along the way.
Yeah. Thank you.
Mm-hmm.
Yeah, it really. So there was a period of about 10 years where Jeff had 7 different surgeries, and 4 of them were brain surgeries.
Yes.
So when you start talking about brain surgery, that's really significant, and it causes side effects. And so not only were there, 7 surgeries, 4 brain surgeries, there was also a myriad of side effects. So there was almost a year of migraine headaches. There was better part of a year to 2 years where he dealt with just a nervous system that was frankly, quite overstimulated. And so the challenge became, though, when, after the first couple brain surgeries, right, we went back to the medical professionals that had done the surgery, like, hey, this is the symptoms that he's having. He's having severe headaches, and they look like they're migraine headaches, and they're, almost all day, every day. And so, hey, doc, what do we do? What can you suggest?
Right.
And so I will say he tried a couple things. They didn't really work at all. And so from that point, he said, well, I'm sorry. A lot of people with this condition just deal with headaches. So you'll probably just have to deal with headaches for the rest of your life. And
wow.
I'm
You must have felt dumbfounded, for lack of a better word.
I was not okay with that response, to be given no resources, to be given no suggestions, no ideas. Now, you mentioned the title of this episode, talking about Eastern care and alternative medicine modalities.
Yes.
But I will say that as a neurosurgeon, he didn't even recommend that we go see a neurologist, right? Somebody within the same, Western medicine community.
Yes.
He had nothing. So
incredible.
that was entirely baffling to me for him to. Now, I want to be really clear. I know you gave a disclaimer.
Yes.
Right? I will give my own disclaimer. I
Sure.
am not trying to badmouth Western medicine by any stretch of the imagination.
Correct.
Because my husband is alive and well because he was able to, have surgeries provided by, Western medicine surgeons. So I thank you,
Yes.
medicine, right?
Yes.
Medical community, thank you. I appreciate that.
Yes.
But what's the next step? What's the thank you. You got us surviving the hospital. You got us well enough to go home.
Yes.
But then what?
Exactly.
Then when there's effects beyond that, when the body has experiences beyond that, where do we go? What do we do?
Yes.
And this is one of my one of my passionate pleas, is that the medical system would start to give us options.
Mm-hmm.
I completely understand that we can't, they have to give their own disclaimers, right?
Right.
Of, so sorry, like, I have no idea if this will work. It may not work. but you could explore these possibilities,
Correct.
right? And
Yes.
so that's, anyway, I'll
No,
kick it back to you, but that's my starting point.
no, but what you're saying in all of that is that basically, even though his condition, like he said on the show that we all did together a few weeks ago, is that it began 2 weeks after birth with his first surgery, and then he basically had a lifelong condition. I mean, yeah, he still has the shunt in his head in order to
Yep.
prevent the hydrocephalus from overloading and whatever it does.
Essentially creating damage to the brain. Yep.
Yeah, but he is functioning at a high level. I
Yep.
see that obviously those Western medicine doctors have done their best to maintain his quality of life.
Yep.
But at the same time, it's like the equivalent of he's been through some earthquakes, and even though the earthquakes are not happening, there's still always the possibility of an undercurrent or tremor happening. And that's when I begin to see alternatives like mindfulness, like neurofeedback, which is what he did, like acupuncture, like all of those other things that sometimes are out of pocket. There's no Medicare, Medicaid, or even insurance coverage on those things, but they give you more vibrance, more energy, more focus, more what is that word that they say? Homeostasis, when your
Yep.
body is in balance with your mind and your spirit.
Yep.
And all of that, it has in this country in particular, in my view,
Yep.
it has but that's so boutique, that's so expensive, that's something that is optional, that is something that they, like dentists would call cosmetic, and therefore they use that as the excuse to not cover it, and you have to dig inside your pocket and choose between your rent and your food and your acupuncture, and most people choose the rent and the food, and
Sure.
therefore their lives don't remain in balance because they're at least sustaining their lives. But then the doctors are there if it's something that's covered by Medicare, Medicaid, or regular insurance. So it's almost as if the Western system is designed to cover what they can see and to not
Right.
cover when everybody's going through life. Everybody has different thoughts on their mind, whether it's their health or whether it's their finances or whether it's their job or maybe, God forbid, they're going through a divorce. Whatever the story may be,
Right.
they just don't care. They can't care. It's not something that's their business or that they have to fund, and that's how they're treating healthcare. Like it's a
Yeah.
commodity that only is of noteworthiness when there's a crisis that can be managed or
Right.
when there's something that can be operated on. And in some ways, I mean, it seems like it's more so that way now than it was when I was growing up. And that's over 50 years ago. So the thing is, it seems like to have gone backwards, and yet when you go to
Right.
Europe and you see people getting cosmetic surgery partially covered by insurance and only costing 16,000 euros instead of $250,000. Wait a second. What is the difference? Well, the difference is European Union might have a capitalistic nature with the euro amongst 32 different euro states, but each country represents its own culture and history and legacy, and that's what they rely most on.
Right.
Which is why you might find a lot of people who do medical tourism go to Europe to get better care because they are investing in you, the human being, not you, the commodity.
Right. Yeah.
So
Yeah. Like you said, like some people, a little bit back, you said some people have to choose between rent and food and their quality of life.
yeah,
Right. And so of course you're gonna choose like living,
security.
yeah, versus necessarily quality of life, which is deeply saddening to
Yes.
me, right? That
Saddening, depressing, frustrating.
we
Yes,
shouldn't have to make that choice, right?
exactly.
If we can choose to live, let's also choose to have that life be the best quality of life.
Yes. And I'm sure that many of the Western medicine doctors and specialists have gone into that field for that very reason,
Right.
but then they get subjected to all the policies and procedures of that
Mm-hmm.
hospital system, or even if they're running a private practice, they've got to follow whatever their license mandates that they can do in their given state. They have
Yeah.
to follow whatever Medicaid or Medicare or insurance rules and guidelines. Most people cannot, unless they're wealthy, cannot afford to pay for their health care, especially things like plastic surgery or whatever.
Mm-hmm.
So they end up kind of sacrificing by default their original intention to really create change and impact for their patients. They do what they can up until a certain point.
Mm-hmm.
And then they almost switch you into the legal system when they want to put you as regular patient into palliative care, or worst case scenario, hospice care. The
Right.
words sound beautiful, but they're not. When
Yeah.
you get into those kinds of setups, you go from first class treatment to business class to
Mhm.
coach.
Right.
You know?
Yeah. Yeah.
And
Yeah.
trust me,
And
I've been in coach. It doesn't work.
I was going to ask, was that your experience then with, you mentioned, you have experiences probably with yourself and also with your father?
Oh yeah, well, you see, I think what I find interesting in my circumstance is I've been a firm believer that a lot of what I developed over my life, like my epilepsy, I did find out it's genetic in nature. So I was destined to be an epileptic and probably to have a better vision of what my life was supposed to be about. And recently, I mean, I will go into my own epilepsy history to emphasize what I'm talking about, but recently with my father going into the emergency room and ultimately having a 12-day stay at NYU Langone Health for
Mm.
metastasized cancer.
Oh,
I mean,
yeah.
basically, I found myself acting as I'm already prepared. I've had to practice through my show and through my own health experiences and in negotiating with different insurances how to be able to understand he's now a case study that I can apply my efforts to. But it's
Right.
frustrating because now I know I need my lawyer and I also
Yeah.
need a real support system around me because we're dealing with end of life treatment
Yeah.
basically, but
Yeah.
they never say those words. They never do. So it teaches me that, okay, I must have had enough preparation with my illness and condition. And again, with my show and speaking to people like you and Jeff and all the other guests I've had on Frank About Health to be able to actually have the conversations with the doctors. And they would look at me like, how dare you talk to me as if you're the doctor? Well, how dare you talk to me as if we're non-existent, you know?
Right. Yeah.
But all right, let me be more specific. I've already given you my opinions before I gave you the story. Um, I developed my first seizure when I was 16 years old. I was in high school.
Okay.
And I continued to deny that I had epilepsy. I thought I was exhausted because I would do all-nighters. I would be studying for exams and I would drink
Mm.
coffee. I haven't had a cup of coffee since 1986, so that should show you how I've learned to accept epilepsy.
Wow.
But the thing of the matter is that it took me 2 years and a possible drowning in the bathtub
Oh
during a
my gosh.
seizure to finally convince me that I had epilepsy.
Mm.
And when I went into the hospital that night, especially, they gave me every test, EEGs. They wanted to give me a spinal tap, but at age 16, I said, no, you're not touching my spine. I didn't want to become a paraplegic and not even graduate high school. But the thing is that I was finally convinced I had epilepsy, and they gave me my first drug, which was called Dilantin, a very
Okay.
toxic drug that affects the liver. But
Okay.
I didn't know that at the time. It was just preventing seizures. But no, there were still side effects, right? And sometimes those side effects would trigger seizures unto themselves.
Oh.
Or I found myself having gone through surgery on my knee when I had a knee, my kneecap got shifted during an
Yeah.
accident in a
Yikes.
dance club of all places. I was in the music industry, so I did the wrong dance move and my knee went the different way. But after
Oh.
arthroscopy,
Mhm.
my Dilantin was no longer with efficacy because I was on painkiller, codeine, and stuff like that. So they switched me to another drug and another drug and another drug until they realized that I was genetically bounded epilepsy. Shout out NYU Langone Comprehensive Epilepsy Center. They do know their stuff. And they gave me a drug called Depakote, which was programmed or given to people with genetic-based epilepsy. And it gave me
Mm.
vision, meaning more energy, more excitement, more enthusiasm. And it finally, it had a short shelf life. So after about 5 years, I had another seizure. Finally, they gave me something that psychiatrists would give to people that had bipolar disorder or schizophrenia. They called it Lamictal.
Okay.
And it would be to regulate the mood and whatever. And certainly it did. And it also prevented my seizures to the point where I had been seizure free for 20 years.
Wow.
Exactly. And so I guess I outwore it because all of a sudden it was such an on demand drug in those two different fields, psychiatry as well as neurology, that they were now charging you. The insurance wouldn't cover it anymore unless you bought the generic version of the drug.
Okay.
And the branded version of the drug in this country cost about $750 a bottle. And this is going
Whoa.
back to 2009. Right now, I don't think they even sell it anymore in this
Wow.
country. But if they were to find it, uh, I would estimate the price to be about like maybe $3,000 a bottle.
Jeez.
The chemical name lamotrigine basically is the one that's still on the market, and Medicare will also no longer pay, or
Okay.
insurance will no longer pay,
Okay.
because there are better drugs than that called Keppra, which I now take only to stop partials, which I inherited after an attack. But I no longer take for full blown epilepsy because it's safe to say, my doctor has said that I have receded from having grand mal epilepsy.
Okay.
The trigger's been turned off permanently, but
Right.
if I don't take my Keppra, I have my out of body moments, so I know that my
Mm.
partials are still ready to rock and roll if they want to.
Okay.
But in all of that process, I
Mm-hmm.
had to learn about all the different drugs, how the pharmacies view them, generic versus branded, which countries offer more potency. Um, at the same time, how would insurance view it as a tier 3 drug? Do I have to do any savings for out of pocket expenses? Stuff like that. So I found myself slowly falling into the healthcare world as a professional. I went and got my master's degree in neuropsychology. My
Okay.
thesis was on epilepsy and its relationship to depression,
Okay.
and looking at quality of life as well as the different variables of socioeconomic status of the individual, um, race, what part of the world they were from,
Mm. Yeah.
gender, if they were comorbid, meaning they had a brain tumor or they had surgery in the brain and it triggered seizures. Like,
Mm-hmm.
what is the difference between that type of epilepsy or those people that just developed it like I did?
Mm-hmm.
And I learned a lot of differences that it exposed me to many different fields, not just neurology and psychiatry, but also understanding your entire metabolic system, because your central nervous system would be the catalyst that triggers the electrical shorts in your brain, as well as whatever other muscular or organic, with your organs, what other side effects could occur during a seizure.
Right.
So I was slowly morphing into the healthcare profession, and I just needed to talk about it because you can't talk to the doctors openly about this. So I developed my show, Frank About Health, in 2021. So for me, it's been an evolution. My condition drove me to become an advocate for it, and it involved learning the legal, the medical, the insurance, the all of these aspects of it, and I always found the gaps that are never spoken about,
Right.
because the hidden secret that I conclude, I'm not saying that this is what's going on, but it's my conclusion, is that Western medicine is about what is going to give us more profit and what is going to sustain more lives, and which one weighs heavier. And they make their decisions according to that,
But
which
I,
means that if it's something they can't see or understand, and there's no way to guarantee insurance coverage, and there's no cure, they stand back. That's when the question is, what alternative treatments can I go after?
right. Right. But I'm going to give maybe counterpoint. Are they
Okay.
really trying to bring health? Or
That's a
are
very
they
good
trying
question.
to, are they, I, I want to be careful how I word this, right?
Yes. Are
Because
they trying to increase mortality rates?
individual professionals within an office setting, they will absolutely, I believe that a lot of individuals have a heart to, serve and make better the life of the person that's in front of them.
Yes.
My concern, though, is medicine
Commodity
an industry,
as an industry. Okay. Pharma industry.
right, is not concerned with the same level of care that an individual is in an office setting. Because
Yes. I'm listening. I mean, you're onto it. You're onto it.
because to be able to have more people, sorry, but more people paying for office visits, more people paying for drugs and prescriptions, more people paying for surgeries and hospitals and ERs, and that brings money in their door. And
Yes.
so I would respectfully challenge the viewpoint of, I don't know that, I don't know, big med. I don't
Big
know if
pharma.
big med, big pharma as industries, I don't know that they're seeking health and well-being for the American public.
Yeah.
Uh,
To answer your question in the best way that I can,
yeah,
I would say that you have a population of 340 million people in the United States right now, I believe it is.
right.
And you can imagine that maybe a good third are seniors 65 and older,
Okay.
baby boomers, Gen X, whatever. Mainly the baby boomers at this point.
Yeah.
Or I could be wrong because I'm Gen X. I was 67, so I
And
don't
the,
know. I
and
don't know
the
where it
tail
fits.
end of Gen X. Yeah.
Right, exactly. And they themselves, they are automatically enrolled in Medicare, and if they are eligible, they can apply for Medicaid. All
Yeah.
right. Medicare and Medicaid is the country, the government's investment in their seniors.
Okay.
Okay, you become part of the senior club, and then you
Okay.
get support from your government. But unless you're disabled or probably fit the standards of the Affordable Care Act, but I don't know, that has been changed dramatically in the past year. So I don't know if anyone still fits those standards. You can get Medicare Advantage or Medicare at an earlier age. I did get Medicare when I applied as disabled with Social Security in 2009.
Okay.
So I have some of the benefits of Medicare, but if I'm smart, which I think I am, I will sever that by the time I'm 60 so I can claim full full Social Security by the time I'm 70, which is significantly more money than what I'm making right now. If I don't
Mm-hmm.
let go of it, I will continue to get what I'm getting from Social Security now, and my rate will not increase to what I'm entitled to. You see,
Interesting.
I have to think about my health as an investment
Right. Right.
within this society. Now, that being said, because of that population and the statistics that go into that,
Mm-hmm.
the Medicare and insurance systems, which drive about 40% of the profit margin in the healthcare sector in this country, basically are looking at the statistics of what percentage of the population can we treat successfully. That's how they base their premiums. That's how they
Okay.
base who gets coverage and who doesn't.
Okay.
If you are someone that is chronically ill or possibly has a pre-exposed condition or whatever, there'll be so much pushback on getting coverage that you'll be lucky if you're able to have like a high yield savings account or something to pay for the stuff out of pocket. And I would like to think that that's a small percentage, but after the passing of the big beautiful bill in July of 2025, I think it's more of us than it used to be.
Mm.
I don't know. I
Yeah.
think to answer your question as frankly as possible, it's not that they are in an outright intention to eliminate part of the population. I don't think it's that.
Right.
I
Agreed.
think they are in a situation where if you're truly invested in your health care, meaning living a high quality of life, you're also going to put out your share financially. The government is not going to be there for you as we used to be. So you have to think about, well, what do you want your life to be like in your 60s, 70s, and 80s? Save for that if you can, or
Mm-hmm.
also consider alternative care options outside of this country, or even those Eastern medicine solutions that exist within this country, again, out of pocket. In other words, own your health care. Don't let
Right.
the insurance companies, the pharma companies, the hospital systems, including the doctors, nurses, and whomever, own it for you. I had a person on my show, Terry Mulligan, who gave me a perfect metaphor that the healthcare system is a boxing ring with three contenders. You
Okay.
have the big guy who represents the insurance companies at 40% profit margin. You
Okay.
have the middleweight guy who represents pharma with 25% margin. And you have the newcomer, which is the hospital system with 3% margin. And
Okay.
the moderator is the guy that is making deals behind the table, either with the government or with side bets as to who gets an extra deductible or whatever the situation may be. And the patients are just watching the game, which means the patients have no say in their own healthcare, the way the system is currently. So in order for people to beat those odds or statistics that doctors or even government heads are stating,
Mm-hmm.
you have to be prepared, probably have extra savings, have extra support from medical people that might be within your own family, probably consider getting treatments in Europe or Asia or down in Latin America or Canada even, that has a wonderful healthcare system.
Right.
But the thing is that it's a bigger picture that this country will not sustain. I think
Well,
more by choice.
right. To carry your analogy of a boxing ring, and all of us in the audience are watching, we're not just innocent bystanders, though, right?
Yes.
If you think about a boxing ring, maybe spit goes flying, right? Or maybe,
Yeah.
right? And so
Yes.
we're getting spit on,
Yes, which is why,
we're
but
getting
it's
injured.
but we
And
do live in a country with freedom of speech and freedom
right?
of expression, right?
Yeah.
So
Hmm.
it is up to us to take ownership, especially if you're living with whether it's an invisible condition or a chronic condition. Get all your knowledge and information and resources together and participate in the match,
Yeah. Yeah.
where you work together. But we
Hmm.
do live in a profit motivated world. So the insurance companies, again, I'm giving all credit to Terry Mulligan on this because this was his research and his presentations that he gave to top notch universities and medical systems around the country and
Yep.
around the world. And when I learned from him this reality, I said, well, I've been onto something, but I didn't get the clarity until he was on my show. And so therefore, I like to say that I'm in a position, especially you and Jeff are in a position to collaborate with me on us together building that situation or that solution that we
Yeah.
can all participate in and also complement with the insurance companies, the pharma companies, the hospital systems, the doctors, the nurses. We all work together. We don't become part of the audience, we become part of the show.
Yes. Yep. Yep. Absolutely. Yeah,
Exactly.
to your point, yes, absolutely have to advocate for ourselves, right?
Yes.
Like you just said, like gain the knowledge, gain what are the possibilities? What are the options? And so to
Yes.
go back to my story, right, where, Jeff and I go back to, medical professionals and they're like, sorry, guess you're going to have to live with headaches. There's no way I was going to accept that
Of course. Of
answer.
course. Of
And
course.
so that's when we started on our journey of, does cranial sacral help? No. Does chiropractic help? A little. And we went through a lot, and I'll be upfront that our health savings account, it took a hit that year for sure.
But it was
Um,
worth the investment because if you don't use it, you lose it anyway.
well, yes. And I mean, it was worth it because we found something that worked.
Right.
But when you were talking about, like medications going skyrocketing in price, right? $500, $700, $1,000,
The
$3,000.
branded drugs because Pfizer or Merck or whoever was manufacturing them needed to get their cut.
And so I mean, okay, so $3,000 versus, like the neurofeedback therapy that we got, that's like $100 a treatment, which $100 out of pocket is not great. But if you compare it to, prescription or a name brand, pharmaceutical,
Right.
uh, you know, that could be a bargain.
Exactly.
To go with the alternative option. So
Exactly.
I think a lot of people, another counterpoint, right, is, people are hesitant to consider alternative options that aren't supported by insurance.
Right.
But sometimes
Right.
insurance doesn't cover things either. And so why don't we go ahead and explore that alternative modality that might not be as expensive as we think it is.
Right, exactly. Because again, that's all about the sense of security that we were
Right?
talking about, right? Now, people who only think about insurance versus as the source of security in a type of treatment are basically saying that to them, if it's covered by insurance or somebody is paying for it, then it's secure. No, no,
Right?
because technology is always advancing.
Right?
Medical techniques that didn't exist 10 years ago are now, finding solutions quicker by leaps and bounds. And that threatens people, especially in the insurance field or in the pharma world,
Mm.
because then they lose their profit.
Mm.
So the thing
Mhm.
is that people have to shift the mindset to
Yeah.
know that the security is in the caregiver practitioner that you're dealing with. So when you have the reaction, like what you said about that doctor was like, there's nothing we can do. That means you didn't finish researching your part of the task. I will
Right?
now go to the next person to give me the supplemental answer that you're lacking.
Beautifully said.
Thank you.
Beautifully said. You're absolutely right. I'm sorry, medical professional. I know that you went to school for 8 to 12 years. However, you didn't finish all of your research to
Well,
know
or better
that.
yet, they could have, I wouldn't call it a gag order, but probably for the hospital system that they're associated with, or maybe with whatever agreements they have with the insurance company, they may know there's a solution, but they're not allowed to tell you what it is, because if they do, then they'll lose the relationship with that protector or that insurance or that license. So it's like in some ways, now you can see why in that boxing ring methodology, the hospital system, which contains the doctors, the nurses, the real healthcare practitioners, get only 3% of the industry. So people who are the protectors through insurance get most of the profit. That says to me that this is not, it's a zero-sum game. The healthcare industry or profession is about serving on a strict and tight budget, which says that if you're forced, especially with ongoing recurring conditions or invisible conditions, you
Right?
need to seek for alternatives outside of the United States, whether they're financial or whether they're healthcare related or medicinal or surgical or whatever. Now, no one is able to do that as easy either, but
Right?
but I have already been in discussions with different people, including yourself, which we're keeping private during the show, of coming up with a product solution that actually complements those sectors, but still it's owned by the consumer, the
Yeah.
patient,
Yeah.
where we can
Yeah.
actually earn our health care through our life, our livelihood,
Mm.
and use that to supplement what is not available during times of crisis.
Yes.
you
Yes.
know and
I'm
most people are not
excited.
awoken to this fact because they don't have a chronic illness, well, most people, so therefore they only go to the doctor when they need to, and therefore they're not going to spend their time researching the details like people like us have had to.
Right? Yeah. I mean, yeah, research, absolutely. I when I was looking at Jeff, there's been a couple times, like I said, there was that period of 10 years. And there was a couple of times where, like I said, there was a time where he was on the couch for the better part of the year because he had migraines.
Yes.
And so I'm thinking to myself, I'm not okay with this. I want my husband back.
Exactly.
Right. And so to what degree am I willing to do the research, right, to learn the things that the medical community couldn't or wouldn't tell me about? I have to take that on myself. I have to take on the responsibility for that if I want a different outcome.
Correct. And then, but what's ironic is in your case, this is your spouse. This becomes part of your daily habits anyway, whether you knew it or not.
Right.
And I can relate to that, especially starting with May 14th, 2026, when my father was bleeding while urinating. Okay, his cancer has metastasized to the bladder. I called it right before he went to the emergency room.
Yeah.
And then when the emergency room validated it, they took him in as an inpatient and they had him attached to a catheter. To this day, he has a catheter, but it's now on the upper level of his abdomen, so he has more comfort in that sensitive region. But the bottom line is that he's going to be 95 on August 5th. So as a result, we know what's next.
Yeah.
All we can really do is manage his symptoms and manage his quality of life until the inevitable occurs. They're not going to operate on a 95-year-old person.
Right.
All right.
Yeah.
They wouldn't do that even if it was a Western motivation, because surgery at that age can lead to the mortality faster than the illness can. All right. However, the other aspect of things is that it metastasized also into the bronchial space of his lung.
Oh.
No treatment was provided at all. That could be no, because that would take him. Now, meanwhile, they did agree, by some miracle of miracles, total shock, to do radiation on the bladder.
Okay. All
they
right.
stopped the bleeding. And they said it stopped for at least a year.
Okay.
Which is wonderful. But it means it's coming back because they're not going to remove the tumor. They just stopped the bleeding in the tumor. And it's still growing. So all of a sudden, I find myself reaching out to friends of mine who are nurses, friends of mine who are doctors, even my own doctors, done my own medical research at NYU Langone. And I basically say, wow, he's got to be put on palliative care. And at the same time, I got to get a whole host of caregivers, visiting nurse service. I got to deal with a nutrition program. And his breathing spasms that occur because of what's in the lung needs a nebulizer. So we got a prescription for it, but it had to be paid out of pocket by the caregiver because it's not part of his original diagnosis.
What?
So, yeah. So this is where I'm answering the question a little early before the show ends, that it's not Eastern or Western. It's both.
Yes.
It's both. People can't think point counterpoint, even though for description of comparison, that's what we need to do. But you need to have integrative, holistic treatments. And I know Jeff and my mutual friend, Tom Ingenio, is definitely into that. So I think that's why he probably, when he was on his show and when we did our reunion show together, we just felt like we were a bunch of old schoolmates talking about healthcare and how we can all collaborate and help each other, which is exactly what we all need. But here's the unfortunate reality. Most people who are healthy don't want to be thinking about that. They don't want to engage in that. It's depressing.
Right.
They only get to that level when they have no other choice.
Right. It's so true. Yeah. Yeah. If you don't have to be, you're right. You're not going to be thinking about both.
Yes.
And so then when something, unfortunately, always, I shouldn't say always, almost always something health related is going to happen to you or a loved one.
Exactly.
And then what do you do? And I really I completely support your point. I know that sometimes I dig a little bit on Western medicine.
No, that's fine.
But I really do. But I really do. Like I said up front, like I do have gratitude for, Western medicine.
Yes.
And, to the point that you just made, right? we got to have both. We've got to.
Yes, you got to
There's,
have both. You got to
they
have.
do different things, but they, Frank, as I was thinking about this conversation that we were going to have, I was trying to think about an analogy or a metaphor that I could bring up myself.
Okay.
And so if you think about, let's say, chocolate, yummy,
Yes.
delicious,
Yes.
right? In its own right, chocolate is fantastic.
Yes.
And then if you think about peanut butter, yummy, fantastic in its own. I eat peanut butter by itself.
Me too. It's okay. It's all right.
But then when you put them together, right? Chocolate and peanut butter make something totally different, but
Nirvana.
still, right?
Reese's.
But still fantastically delicious, right?
Yes.
For most
Exactly.
people, I know. But right, to have that combination of, two things that are great, coming together to make something else that is still great.
Yes.
So how can we promote that? Right? I'm not sure what the answer is.
Well,
to that
believe it or
question.
not, you and I, well, actually, Jeff is the face of Invisible Condition, but you are definitely behind the scenes with him on it. So I'm sure you're aware of everything that he's been doing. And of course, I have Frank About Health. The thing is, one way of creating that peanut butter gets into your chocolate is by having a weekly show.
Yeah.
And by getting to your audience and ringing in, why I call it Frank About Health, not because I'm just Frank, I'm being truthful. This is what we've got. This is what is in front of you. Let me wake you up. Tune in Thursdays at 2:00 and wake up, because the only way you're going to have peanut butter in your chocolate is when you get out of the audience chair, join the people in the boxing ring, and say, look, I've got something to add to what you guys already have.
Right.
Not only me, the patient, but also look what I discovered.
Right.
How can we incorporate that together? So I would say, aside from finding ways to bring consensus or bring people together, one thing, especially those with critical illness or invisible conditions, have as much self-awareness as much as possible. You're aware of every impulse going through your body. Is that a reaction? Is that something of an instinct? Is that something that needs medication or treatment? Is there something wrong that I'm feeling weird about? First, you have that self-awareness, and then you integrate it into your community of people that will take ownership of what you're saying, and they will bring their input into it. And that's why I say the way to make that metaphor of the peanut butter and the chocolate is build your tribe, build your community, and together you take action for a secure health system.
Yes.
One that is run by the patients.
Yes.
And you don't need to be in a specific country to do it. The beauty of Zoom, and unfortunately the beauty of COVID, is that it forced us all to become a community. And that's when we got the vaccines rolled out within, months? That would have normally taken 10 years.
Right, right.
People don't want to find cures for epilepsy, and there is a cure, but they won't do it because it costs too much money. All right? They rather exercise the profit margin of the pharmacy business. So when you're lucky enough, like I am, to not have full-blown seizures anymore and not need the medication, you can then say there is a pathway out, but it all points to one's own sense of self and the ability to integrate with others that can see your mission clearly and work with the government if you can. Highly doubtful, but if you can, to be able to create newer solutions that benefit everyone, including those that have an ultimate end. It sounds like philosophy, but it can be done. It's just that what's unfortunate, especially recently in this country, is that whatever steps we moved up on since especially the time of COVID, we have fallen back, probably knows if we're back in the 60s or 70s at this point, because of the big, beautiful bill and different policy changes that were meant only to disrupt what we were working on.
Yeah, yeah. Well, I know, people watching this show, I hope we're on the same page.
Yes.
And also I would, I'll just put in a little plug as well for my
Sure.
husband's show, right? For Invisible Condition
Yes.
on E360. It's on every, as we're recording this, it's on Tuesdays and Fridays, at, noon Eastern.
Yes.
At some point, my husband is looking to start a new show, which will take over that Friday's time slot. So if you don't see it Friday, look for it on Tuesdays. It's also on YouTube, Facebook, and LinkedIn. Look
Yes.
for Invisible Condition. So yeah, thank you for letting me plug that.
Oh,
Anyway,
no
back
problem.
to the
In fact,
regularly scheduled program.
but you have just also made me plug this, which is what I talked about on my last two shows. My new Healthy Media app, which is going to show this show as well as plugging Invisible Condition and also an upcoming event that you and I are behind the scenes working on.
Yep.
Which I don't know. Do you want to talk briefly about it later on, or do you want to just wrap up the show and let everyone find out about it as I promote it during the coming months?
Well, maybe we could just tease it a little bit, you know?
Okay. All right. Well, everything that we've talked about just now, both you and I, basically concludes that you and Jeff have been working through the medical community and the medical system and working with both Eastern and Western Medicare medicine doctors to
Yep.
be able to give him the quality of life without migraines, which
Yeah.
he obviously has developed.
Yeah.
Simultaneously, I have been working behind the scenes to introduce a new financial product that could be beneficial to people both with and without insurance, as well as cover expenses that are not normally covered by insurance. And that means that you and I are going to collaborate on developing a limited series right here on E360 TV.
Yep.
Where I want you to share the narrative behind it because it was your idea. I just love it because it allows us to go through the September promotion cycle of that series into the live event that we're going to have in October over at Fordham Gabelli School of Business, where we will have a panel discussion of truth tellers, healthcare advocates, doctors, nurses, people like ourselves who will be able to give the whole understanding that we are the community taking action for a secure health, and hopefully even launch my product at that show. But more importantly, bring other people like viewers such as those watching this show right now to become involved, whether they want to appear on our respective shows, or maybe they happen to be medical professionals themselves that would like to advocate for our respective solutions. I mean, the question is not, is it Eastern or Western care? We did answer it's both, but it's building community. And that's what we together can definitely do between now and October, for starters.
Yes, yes. Oh my gosh, I absolutely yes. That to me, that is the dream, genuinely, right? If there could just be, a community, a communal, response, when somebody has, an illness or a heaven forbid, something happens, to your health, if there could be a team,
Yes.
right? A team effort, a team response to say, you know what, I can handle this. And then after that, I'm going to pass you off to this, right? Like I've got you, I'm going to keep you alive.
Yes. Yes.
And then after that, I'm going to pass you off to people who are going to improve your quality of life. Right? To have, like you just said, community, I think is a beautiful word.
Yes.
To really embody what, at least for me, what the ultimate dream is, right? The
Absolutely.
community of, yeah.
And that's what the beauty of E360 TV and Ariane TV is about. Julianne Meyer has done a great job of building a health and wellness community, and I'm hoping that our live event in October will be able to highlight that with great emphasis, because the community is not just the individuals we've been speaking about, but the community is the insurance companies, the hospital systems, the pharmacies, the alternative treatment centers, the clinics, the palliative care specialists, the nurses, the patients themselves. We let the government or somehow make the government work with us. You know, we also ensure their profits, but
Sure.
we also ensure longevity and
Quality.
high quality of life.
Yeah, absolutely. Yeah, so tune in, everybody. Keep
Yes.
watching, so
Yeah.
you can learn more, you can hear more, you can see more about what we are alluding to.
Absolutely. And
Yep.
of course, beyond this show, every other show, I will feature the QR code where you can find more information, not just about Frank About Health and Invisible Condition and our limited series and our live event, but you can also buy the books and listen to the podcasts of other people that have been on our previous episodes. We're definitely working closely to build this community together on our respective shows, but at the same time with all of you. And we want all of you to respond to us, to our social media, our emails, or even write comments on our YouTube channel or wherever you see the shows so that we can listen to you. We're here to serve you as well as part of the community.
Yep.
I think this has become the end of our show.
Right. Subscribe, like, tune in, follow,
Exactly.
watch, all the things.
And share with everyone.
Yes, please. We would be honored if you would share.
So thank you, Catherine, for being again on Frank About Health. And I look forward to working with you closely, especially in the coming weeks on our limited series, which everyone will hear more about as the weeks come on. And for that being said, I want all of you to enjoy the coming weekend and to stay tuned to next week's episode of Frank About Health. And please give Jeff my best. Okay?
Absolutely. Thank you so much.